All right, everyone, scrubs on. We're about to dive deep, deep into the world of hernia repair, specifically the open surgery kind.
That's right. We've got some juicy excerpts from a medical textbook all ready to go. Think of this as
A surgical boot camp, but without the sweat.
yeah, exactly. Less sweat, more knowledge.
So by the end of this deep dive, you'll basically be hernia repair experts, or at least you'll understand what surgeons are thinking about when they're in the OR.
We're going to walk you through the techniques they use, the factors they consider when making decisions, and oh yeah, we're going to bust some myths along the way.
Ooh, I love myth busting. In fact, did you know there's actually a type of hernia repair named after a Canadian town? Talk about local pride. We'll get to that later. But first, Hernia 101. What exactly are we dealing with when we talk about these inguinal and femoral hernias?
Well, imagine your abdominal wall is like a strong piece of fabric.
Okay, got it.
A hernia happens when there's a weak spot in that fabric and something pushes through. Usually it's a bit of intestine, and it creates this bulge under the skin.
I'm getting the picture. But our source material mentions all these different types. Inguinal, femoral, direct, indirect. It's all just weak spot bulge, right?
Well, yeah, but the location of that weak spot is key. Think of your lower abdomen as like a busy intersection. You've got all these structures crisscrossing. Muscles, ligaments, blood vessels. The inguinal canal is a common spot for hernias.
The inguinal canal.
Yeah, it's like a tunnel through this area. An indirect inguinal hernia, which is the most common type, pops up right at the internal opening of that canal, a spot we call the internal ring.
So it's like taking a detour off the main highway.
Exactly. Now, a direct inguinal hernia, that takes a different route, pushing through the abdominal wall itself in a spot called Hasselbalch's triangle.
The same intersection, different exit ramp. Got it.
Yeah.
Okay, what about femoral hernias? Are they hanging out at this intersection too?
Femoral hernias, those are a bit lower. They go through the femoral ring, a tunnel beneath the inguinal canal. This tunnel carries important stuff to your leg, the femoral artery, vein, and nerve, so any weakness there can cause problems.
Okay, starting to map out this anatomical landscape in my mind. So no matter the type, the problem is a weak spot. How do surgeons actually fix that? Do they just stitch it up?
Well, stitching was the go-to for a long, long time. But it often led to tension, which made the hernia more likely to come back. It's like trying to patch a hole in stretchy fabric. It just wants to pull apart again.
Makes sense. So you need something to, like, reinforce that weak spot.
Exactly. And that's where mesh comes in. It's like a strong, flexible patch that supports the weakened area, reducing that tension and creating a more durable repair. It's kind of like reinforcing a weak spot on a pair of jeans. It takes the strain off the stitching.
I like that. A patch on our internal jeans. Genius. So that brings us to the Liechtenstein technique. Our sources call it the gold standard for open inguinal hernia repair. Why is that?
Well, the Liechtenstein technique is popular because it's pretty straightforward and it works. It's like the trusty hammer in a surgeon's toolbox, you know. Reliable, gets the job done.
All right, I'm prepped and ready for surgery. Walk me through it. What happens during a Liechtenstein repair?
Okay, so the surgeon makes an incision near the hernia, so they've got a clear view. They identify and protect any nerves and blood vessels in the area very carefully. Then they dissect the hernia sac, which is the part that's actually bulging out.
So they've exposed the weak spot, and now it's time for the mesh.
Right. They shape a piece of polypropylene mesh, which the body tolerates well to fit that specific area. And this mesh patch is like meticulously secured to the tissues around the hernia defect, almost like they're building a new wall.
Creating a reinforced barrier. Love it. But our sources talk about being meticulous, especially around nerves. What happens if there's nerve damage?
Well, nerve damage can lead to chronic pain, which is definitely something we want to avoid. The ilioinguinal nerve, which runs near the inguinal canal, that one's especially vulnerable.
So surgeons have to be extra careful around that one.
Absolutely. Some surgeons even choose to just go ahead and transect the nerve during surgery.
Wait, cut the nerve. That sounds counterintuitive. Wouldn't that cause more problems?
I know, right? It seems strange. But this approach can actually reduce the likelihood of long-term pain from the nerve getting trapped or irritated. Any numbness is usually pretty minor.
Huh. Interesting trade-off. Now, our deep dive shows that hernia repair isn't like one size fits all. What about women? Is the procedure different?
Yeah, good point. We can't forget about anatomical differences. In women, the round ligament, which runs through the inguinal canal, that needs careful attention. And the ilioinguinal nerve is often removed during surgery to prevent issues.
Okay, so slightly different roadmap for women. What about people with hernias on both sides? Bilateral hernias. Can those be fixed at the same time?
Absolutely. Thanks to mesh, we can tackle both sides at once. The mesh provides enough support to make that double repair safe and effective. It's like, well, you get the idea.
Two birds, one stone.
Hmm.
Myth busted. Now let's talk about those femoral hernias. They take a different route, so I'm guessing the repair is different too.
You got it. Using the Liechtenstein technique on a femoral hernia would be like, I don't know, trying to patch a tear in your jeans with a piece of fabric that doesn't quite reach.
Right, you need the right tool for the job.
Exactly. One common approach is a bilayer mesh repair. It's like a double layer protection. One layer of mesh goes behind the abdominal wall, and another layer goes on top.
So double the mesh, double the protection.
Got it.
Now things get a bit more serious with incarcerated or strangulated hernias. Why are those so urgent?
An incarcerated hernia means the tissue is trapped and can't be pushed back in. It's like, imagine getting your finger caught in a door.
Ouch.
And as it swells, blood flow can get cut off, which can lead to strangulation. That's when it gets really dangerous.
That sounds incredibly painful
Yeah.
and dangerous.
It is. Strangulated hernias need surgery right away to prevent tissue death. We're talking a race against time.
So how does the surgery change in these urgent cases?
Well, the surgeon first has to check if the trapped tissue is okay. If it is, they can usually do a mesh repair. But if the tissue is damaged or dying, they might have to remove it and do a more complex repair, maybe even without mesh.
Wow, those are some tough decisions to make in the operating room. Okay, enough suspense. Tell me about that Canadian town and its hernia repair.
Yes. The Schultes technique. It's a unique, mesh-free approach developed at the Schultes Hospital in Ontario. It's like a surgical masterpiece.
Yeah.
Meticulously crafted, no synthetic materials.
No mesh at all. How does that even work?
Well, the Schultes technique involves carefully stitching together multiple layers of abdominal wall tissue. It's incredibly intricate, like weaving a tapestry to create this strong, durable repair.
Wow, color me impressed. But this isn't something just any surgeon can do, right?
You're right. The Schultes Hospital, they're known for this specific type of repair. People come from all over the world to get it done there. They even have a special approach to recovery with a lot of emphasis on early walking and activity.
It's like a hernia haven with a totally tailored approach. I love it. Okay, one more intriguing type of hernia to cover. Sliding hernias. What makes these so special?
Well, imagine a hernia where part of the sac itself is actually made up of an organ, like the bladder, the bowel, or even an ovary. That's a sliding hernia.
Whoa, so the organ is like sliding out of place.
Yeah, basically. So the surgeon has to very carefully separate the organ from the sac and then create a new covering for it, tucking it back safely into the abdomen.
It's like they have to re-engineer the anatomy.
You could say that. It requires a lot of skill and precision. It really makes you wonder how surgeons decide which technique is best for each person with all these different options.
That is a great question. So many factors to consider. We'll have to dive into that more next time. But before we go, let's talk about complications. What can go wrong, even with the best techniques?
Well, like with any surgery, there are risks. Nerve damage, as we talked about, can lead to pain that just won't quit. And mesh, while it's usually very safe, can sometimes get infected.
Yikes. So it's not without its risks. Okay, what about typical post-op care? What can patients expect after surgery?
Well, they'll probably have some pain, which can be managed with medication. They'll need to gradually increase their activity, avoid heavy lifting for a while, and of course, regular follow-ups with their surgeon are crucial.
Yeah, so they can monitor the healing and catch any problems early on.
Mm.
Makes sense. Well, I'd say we've laid a pretty solid foundation in this first part of our hernia repair journey. We've explored the different types, gotten up close and personal with that gold standard Liechtenstein technique, and even taken a little detour to a Canadian hernia haven. But our exploration isn't over yet. Stay tuned for part 2, where we'll delve even deeper into the nuances of hernia repair. Welcome back to our hernia repair exploration. Before we took a quick time out, we were talking about those complications that can pop up. Not the fun stuff, but definitely important.
Right, and it's key to remember that no surgery is completely risk-free. Chronic pain after hernia repair, now that's a concern we take very seriously.
So even after that incision heals, some folks can still have pain that hangs around.
That's right. It could be from nerve damage or inflammation, sometimes even the mesh itself. Surgeons are always working to refine those techniques and find new materials to reduce that risk.
It's good to know they're on the case, always trying to improve things. Okay, let's go back to those other open repair techniques for a minute. Like the Schultes method we mentioned earlier. No mesh at all, which seems kind of, I don't know, almost old school these days.
The Schultes technique is a really interesting example of how a super precise approach, one that's been perfected over decades, can get amazing results. It really shows the skill and experience of those surgeons at the Shoulder Hospital.
It's like they've turned hernia repair into an art form, carefully layering those tissues without needing any mesh.
Exactly. And
Yeah.
they've created this whole culture around hernia care, focusing on recovery and getting folks back on their feet quickly.
So it's more than just the surgery itself, it's the whole patient experience. Now, our sources also talk about the Bassini and McVeigh techniques as alternatives. How do those stack up against the Schuldeis method?
Well, those also involve stitching tissues together, but not with the same intricate multi-layered approach as the Schuldeis. The Bassini repair, that's one of the oldest, it basically connects the conjoined tendon to the inguinal ligament. It's like a simple stitch joining two strong points together.
Got it. And the McVeigh repair, what makes that one different?
The McVeigh is similar to the Bassini, but they extend that suture line further down to Cooper's ligament, which is a tough band of tissue along the pelvic bone. Think of it as adding another ankle point for reinforcement. That McVeigh technique, it's especially useful for femoral hernias.
Ah, so they each have their pros and cons. Makes sense. Okay, let's talk about something nobody wants to hear. Recurrent hernias. Why do some hernias come back, even after a successful repair?
Yeah, it's definitely not what anyone wants, but hernias can recur for a few reasons. Sometimes it's due to something technical in the first surgery, like the mesh not being positioned right, or maybe there was too much tension on that repair.
So sometimes it's about the surgery itself. Are there other things that can play a role?
Oh, absolutely. How well a patient heals, lifestyle factors like smoking, which can weaken tissues, heck, even just plain bad luck can play a part.
So it's kind of a mix of things. What are the options if a hernia does come back?
Well, it really depends on the specifics of the case. Things like what kind of repair they had initially, the size and location of that recurrence, the patient's overall health, all of that matters. It's like trying to solve a puzzle, but the pieces are different every time.
So a personalized approach is key, just like with the first repair. What if that first repair used mesh and now it's back? Do they have to take out that old mesh?
Surgeons usually try to avoid removing the old mesh unless there's really no other option. It can be a real pain, like trying to peel off old wallpaper. Instead, they might add more mesh to reinforce the area, or maybe use a technique called plug and patch to fill the defect.
It's like reinforcing a weak spot in a wall, adding more support where it's needed most. Makes sense. We've covered a lot of technical details, but it's important to remember that behind every hernia, there's a person with their own hopes and worries.
You're so right. Hernia repair, it's about way more than just fixing a hole in the abdominal wall. It's about getting people back to their lives, letting them do the things they enjoy without pain holding them back.
It's about giving them their lives back. And with all the advances we've talked about, outcomes for most patients are thankfully really good. But open surgery isn't the only option, right? What about laparoscopic repair?
Laparoscopic hernia repair, that's a fantastic option for a lot of folks. Less invasive, faster recovery, less scarring. Definitely a topic worth exploring more.
I was hoping you'd say that. We'll have to do a deep dive on laparoscopic repair sometime soon. But for now, we've reached the end of part 2 of our open hernia repair adventure. We've tackled those alternative techniques, faced the challenge of recurrent hernias, and even started thinking about the bigger picture of patient experience. We're back, ready to close out our deep dive into open hernia repair. We've covered a lot of ground, the anatomy, the techniques, even those tricky recurrent hernias. But before we wrap up completely, I want to shift gears a little and talk about the people going through all this.
It's so important to remember that we're not just dealing with abstract procedures here. Every hernia, that's a person with their own unique story.
Exactly. And having surgery, well, that's a big decision. So what do patients need to know? What questions should they be asking their surgeon?
For sure, understanding the benefits and the risks, that's crucial. Recovery time, what the long term looks like, all that's got to be part of the conversation. But here's the thing. Sometimes the best approach might be to just, wait and see, especially if the hernia is not causing any symptoms.
Hold on, you're saying not all hernias need surgery right away?
Not always, no. Think about older folks or people with other health issues. The risks of surgery might be bigger than the benefits, especially if that hernia is not bothering them. In those cases, keeping a close eye on things, that might be the best plan. They can always have surgery later if they need to.
So it's about having that conversation, a shared decision between the patient and the surgeon, weighing all those factors.
It's a partnership, absolutely. And even when surgery is the way to go, recovery is a big part of the picture. What can patients do to heal well and get back to, living their lives?
It's not just about the surgeon's skills in the OR.
Nope, not at all. Following your surgeon's instructions, that's key. Gradually increasing activity, no heavy lifting for a while, managing that pain. But lifestyle choices matter too. Staying in a healthy weight, quitting smoking if you smoke, those things can make a huge difference.
So it's all about empowering patients to be active in their own recovery. Love that. Even with all the amazing advances we've talked about, I can't help but wonder, what's next? What's coming down the pipeline for hernia repair?
The research never stops. We're always looking for ways to make things better, gentler, more effective. For instance, there's a lot of work being done with bioabsorbable mesh.
Bioabsorbable, what's that?
Basically, it's mesh that dissolves over time. It gives support while you're healing, and then it disappears. Less risk of long-term problems.
Wow, it's like a temporary scaffold. Lets the body build its own permanent repair.
You got it. And we're seeing huge leaps forward with robotic surgery, making those minimally invasive procedures even more precise.
It seems like this whole field is constantly moving forward, always finding better ways to take care of patients.
It's pretty inspiring when you think about it. From those early pioneers who came up with the first techniques to the folks pushing the boundaries today, it's all about helping people get healthier.
Absolutely. And to everyone listening, I hope you've gained a new understanding of just how complex hernia repair is.
Yeah.
It's more common than you might think, and now you know what goes into making those repairs successful.
As you go about your day, just remember, under the surface, there's this whole hidden world of amazing structures, brilliant minds, all working to keep us healthy and whole.
I love that. Well, this has been one fascinating deep dive. Until next time, keep exploring, keep learning, and never lose that curiosity.